A motion to support the implementation of a national health insurance plan for the Virgin Islands was debated by youth parliamentarians at the second sitting of the Virgin Islands Youth Parliament on November 25th. The youth parliamentarians on both the government and opposition sides of the Assembly presented compelling arguments for and against the January 1st implementation of the NHI plan. Much of the arguments in support of the NHI were slammed by Leader of the Opposition and member for the 9th District, Ria Vanterpool, who says there are more questions than answers.
The government continually proclaims national health insurance, your security for a lifetime. But what security is there when no reinsurers are contracted? When the government takes on the unprecedented task of funding initial claims? How can we be free of fear when the projected budget allocations do not match what the Minister for Health and Social Development says is required? When we do not even know which doctors are in network? My recommendation to the government is simple. Fill in these gaps. Outfit our health facilities. Iron out the administrative issues. Detail the plan for combating non-communicable diseases. And for the sake of every resident, for the sake of the health of the great-grandmother of the member of the 5th, show the people how NHI will be funded, so that they will know that their health care is indeed secure for a lifetime. Madam Speaker, there are other concerns that I would like to expand on, like the monitoring of fraud, or the fact that members of the government and NHI reps continue to say that $24 is not a lot of money, but ignore the fact that persons will still be responsible for co-payments, and many others. But that would take all night. Johnny Nash sang a song, "There are more questions than answers," over 40 years ago. He must have had a vision about NHI. Until the government answers the many concerns, I cannot support the implementation of national health insurance on January 1st, 2016.
On the contrary, Deputy Speaker and member for the 5th District, Rashawn Malone, lauded the government's effort to implement the NHI. Urging residents to eat more local and healthy foods, Malone says January 1st, 2016 would be the dawning of a new day in the Virgin Islands, and he called on naysayers critiquing NHI to get their act together.
Diabetes, hypertension, cancer, malaria, and the common cold. These names are no strangers to no one here in the Virgin Islands. Sickness is on the rise and can strike anyone at any time. The need for a national health insurance is of the utmost importance. It is the primary responsibility of this government to provide adequate health care to this population, as stated by Health and Healthcare in the British Overseas Territories. Regional and UK government support, a responsibility that this government is taking up like a carpenter would a hammer. This government has made great leaps towards the implementation of a national health insurance system. It is for the benefit of the residents, is it not? So why is there so much opposition? I have heard time and time again that the government of the Virgin Islands needs to improve the standards of our health care. Were we so naive to think that this change would come as if by some unforeseen miracle and that it would somehow fund itself? A national health insurance, as defined by the medical dictionary, is a health insurance program that is financed by contributions and administered by the government to provide comprehensive health care. The national health insurance is a compulsory contribution. Last I checked, residents of the Virgin Islands are required to contribute in some form. These contributions provide revenue used to help improve our communities. The contributions toward the NHI are solely used to improve the overall medical systems of the Virgin Islands. NHI does not strip anyone of their democratic right to choose.
Incidents that highlighted the inefficiencies and incompetence in the public healthcare system was taken apart in a riveting contribution from Territorial Representative Joanna Gibson. Noting that she is not opposed to NHI, Gibson chided the authorities for failing to place emphasis on the development of the public health sector.
1,000 Frenchmen cannot be wrong. And Madam Speaker, I get that our new hospital is luxurious. I get that we've got gold trims and marble now. I get that it feels like a hotel, but Madam Speaker, you tell me, would you walk into the Holiday Inn and ask to get treated for some disease? We don't want a hotel. We want a hospital. I can give you countless examples of something going wrong at our hospital. I can even give you countless examples of mishaps at the clinic on my home of Virgin Gorda, but one in particular stands out to me. In the wee hours of the morning on November 12, 2007, my grandmother awoke with a pain in her chest and had been suffering from a cough throughout the night. Soon after this, the 4 adults that occupy my lodging would rush her to the clinic urgently. My grandmother, a woman in her 50s who suffered from both diabetes and hypertension, would sit suffering, waiting to be treated for an emergency. She was the only patient there. Sometime around 6 that morning, she would be pronounced dead. And the doctor at the time, who lived 3 minutes away from the clinic, still hadn't arrived. I am well aware that death is inevitable, but had the doctor been there earlier, then maybe, just maybe, my grandmother might have lived a bit longer. Our inefficient healthcare system robbed my family and me of more precious memories with my grandmother. And I could go on. I could tell you of a person who went for a simple procedure and ended up with a catheter dragging around with her. I could tell you of a person who was misdiagnosed with a heart disease simply because the doctor took the x-ray from the wrong position. I could tell you of a person who spent 9 long years in and out of doctors' offices being told that she had gas. Gas, Madam Speaker, only to find out after traveling overseas that she had a dysfunctional gallbladder.
Now, the Premier of the BVI Youth Parliament, Soniel Pickering, says the implementation of the NHI plan would mark a turning point in the territory's history. In wrapping up the debate late Thursday evening, the Youth Parliament Premier dismissed concerns raised by his opposition members.
As my honorable colleague said earlier, the hospital is a beautiful thing. I'm not sure about the gold trimmings and the marble floors, but it is set up in a way that it will provide the quality of healthcare necessary for a healthier population for these Virgin Islands. Madam Speaker, the same system that these private insurance companies have with coding of documents and coding of information and claims agents being responsible to hold what they see to themselves and ensure that what is seen on the computers, on the papers, are kept within the 4 walls of the National Health Insurance. That is what we have here with the National Health Insurance, Madam Speaker. Because I will tell you this. The people that will be working as claim agents in the National Health Insurance Program are people who already operated in that field before. They are people who are dependable, reliable, and understands the word confidential. Therefore, if I could put my trust in the same local people who I see along the road every morning when I am on my way to work, who work in those private insurance companies, Madam Speaker, I will stand on assurance that I could put my trust in the same locals who will work in the National Health Insurance Program, because I have faith in the people that are employed there, that they will keep the confidence and keep what they see to themselves. And furthermore, if the infringement does occur and infractions arise where information is leaked from the National Health Insurance, there are laws in place to put them in court.
The founding members of the VI Youth Parliament, under the supervision of Speaker Brianna Nelson, are just getting their feet wet. But already a number of them have demonstrated a capacity to address national issues that are comparable to that of senior politicians in the BVI.